Dr. Marie-Noël Primeau is a pediatrician specialized in allergies and immunology. She is a member of the Integrated Health and Services Center and co-founder of the Montreal Asthma and Allergy Clinic. In this talk, Dr. Primeau will provide parents with a list of guidelines on food allergy prevention.
It is important to prevent food allergies because they affect a lot of people. 8% of children and 4% of adults are affected by a food allergy. In Canada, that means 2.5 million people. The food responsible for the majority of allergic reactions are peanuts, nuts, fish, seafood, egg, milk, wheat, soy, and sesame. When all allergic conditions are considered, that include asthma, eczema, hay fever, and food allergy, then half of the population has an allergic disease. The phenomena that describe the natural evolution of allergic diseases within the same individual is referred as to the allergic march theory. We will often see cases of infants that develop eczema and food allergy, and later on the same child will develop respiratory allergies like asthma or allergy to pollens, cat, or dust mite. It is important to prevent all allergy-related conditions, but preventing food allergy is of particular concern because of its serious consequences. People can have an accidental ingestion, and this could lead to a serious allergic reaction. This reaction could even be life-threatening. Preventing accidental ingestion is a serious and laborious responsibility. Families need to be extra vigilant in situations like parties, family reunions, going to a restaurant, traveling, starting a new school or a new daycare. This extra vigilance can affect their quality of life. There is also a financial cost associated with food allergies, as families need to buy some special food to make sure they do not contain the allergens. Children at risk of developing food allergies are those who have an immediate family member, like a mother, a father, or a sibling, with any allergic condition, asthma, eczema, hay fever, or food allergy. If the child has one parent with an allergic condition, he has 30 to 40% risk of developing an allergic condition. It will not be necessarily the same as the parent. If both parents have an allergic condition, then the risk is increased up to 70 to 80%. Still, 10 to 50% of children without any family history of allergies will develop an allergy. Studies on prevention are often done on children at risk of developing allergy because of their family background. In a family context, when a first child has a food allergy, we are often asked if the mother should modify her diet during the pregnancy in order to avoid food allergies for the baby to come. Studies have demonstrated that it's not necessary to avoid any allergenic food during pregnancy. It does not lead to a reduction of food allergy. Dietary restriction can even lead to malnutrition for the mother or the baby to come. Therefore, pregnant women, where allergens are concerned, can eat whatever they want. As for the role of breastfeeding in preventing food allergies or other allergic conditions, Health Canada and the Canadian Pediatric Society recommend exclusive breastfeeding for the first 6 months of life for all its proven benefits. As far as prevention of allergy is concerned, the role of breastfeeding is less clear. There are some studies showing some decreased allergic condition if the mother is breastfeeding, but the data are controversial. Medical professionals still recommend breastfeeding for all its proven benefits. Some parents wonder if the mother of children with a food allergy should avoid any specific allergenic food while nursing her second baby in order to prevent food allergies. Studies have demonstrated that it's not necessary to avoid any specific allergenic food while breastfeeding. Nevertheless, if the child or the baby has some symptoms that maybe we think it's related to what the mother eats, then it's necessary to consult a physician, an allergist or pediatrician to see if it's necessary to avoid any food for the mother. While nursing is beneficial for all infants, in various situations, a child's diet may need to be supplemented with formulas. Allergists would recommend for the first 6 months of life to use a hydrolyzed formula. That means that the protein in that formula has been cut in small pieces. On the Canadian market, only 2 hydrolyzed baby formulas have been shown to reduce the risk of allergies. They are Good Start by Nestlé and Nutramigen by Med Johnson. There are other hydrolyzed formula on the market, but there have not been any studies showing that they can prevent food allergies or other allergic conditions. We often receive questions about the timing of introduction of solid food. Parents are wondering at what age, with what food to begin, and is there a specific order to follow? The Canadian Pediatric Society recommends exclusive breastfeeding up to 6 months of age, at what age the child can introduce solid food if he's ready. As far as allergy is concerned, allergists will sometimes make different recommendations. If the child is ready, that means if he can sit by himself, control his head, and turn the head to say no if he doesn't want the food or if he's satisfied, we consider that solid food can be introduced between 4 and 6 months of life. There are no specific order to which introduce the food. Typically in North America, we start with cereal because of their high iron content. After 6 months of age, any allergenic food can be introduced. I will sometimes tell the family that ask me those questions that they can go on depending on their preference or nutritional habits. When an allergenic food is introduced, it should be done at home in a calm situation and a small amount at a time. So feed the child an allergic food, very small amount, and continue with that small amount a few times before increasing the amount. Once an allergenic food is tolerated, it is recommended to continue to give it to the child regularly. Some studies have demonstrated that it could help to maintain the tolerance. Although I recommend family to introduce allergenic food according to their preference or nutritional habits, there are now new recommendations for the early introduction of peanut product for certain babies. These guidelines were put in place after we got the result of the LEAP study. In that study, they took babies with egg allergy or severe eczema and separated them in 2 groups. In the first group, it was recommended to avoid any peanut products until 5 years of age. In the second group, peanut products were introduced very early, between 4 months and 11 months of age. And the parents were told to continue giving peanut products several times a week up to 5 years of age. At 5 years, they compared in which group there were more peanut allergy. Well, there were much more peanut allergies in the group that were told to avoid peanut until 5 years of age. Following that, the guidelines were put in place to recommend early introduction of a peanut for certain babies. What is recommended now? If the baby do not have any eczema or any egg allergy, parents can introduce peanuts whenever they want. If the baby has mild or moderate eczema, it is recommended to introduce around 6 months of age. It can be introduced at home, starting with small quantity at a time and increasing. If it's tolerated, of course, the baby should be continue to eat the peanut products. If a baby has an egg allergy or severe eczema, he should see an allergist before introducing peanut. The allergist should be consulted early on because for those babies, we still want the introduction to be done as early as 6 months of age. The allergist could decide to do a skin test or introduce peanut in the office or in the hospital. Again, if peanut products are tolerated, it is important to maintain regular ingestion. Here, I'd like to remind families that there is a risk of choking if whole peanuts or nuts are given to children before 3 to 4 years of age. As for other allergenic foods, we do not have evidence yet that early introduction of those specific allergenic foods will prevent food allergy. Although we know It is not harmful and it does not cause allergy. That's why I recommend family to go with their preferences.